Why is the corpus luteum crucial for early pregnancy success? Imagine a tiny structure in the ovary that plays a big role in helping a new life begin. That's the corpus luteum, a temporary gland that forms right after ovulation. Its main job is to produce a hormone called progesterone, which is essential for preparing the uterus for pregnancy. Without enough progesterone from the corpus luteum, the uterine lining cannot stay thick and healthy enough to support an embryo. This can lead to the embryo not implanting properly or early pregnancy loss. When an ovary releases an egg during ovulation, the leftover follicle transforms into the corpus luteum. Its job during the second half of the menstrual cycle, called the luteal phase, is to secrete progesterone. This hormone makes the lining of the uterus, called the endometrium, grow thicker and become more receptive to a fertilized egg. Progesterone also prevents the uterus from contracting too early, which could push out the developing embryo. It improves blood flow to the uterus, ensuring the embryo gets enough oxygen and nutrients. Once fertilization occurs and the embryo implants, it starts producing a hormone called human chorionic gonadotropin, or HCG. This hormone signals the corpus luteum to keep producing progesterone, a process known as luteal rescue. This support continues until about 10 to 12 weeks of pregnancy, when the placenta is developed enough to take over hormone production. At that point, the corpus luteum gradually shrinks and stops secreting hormones. The corpus luteum also produces relaxin, which helps relax the pelvic ligaments and supports blood vessel dilation. These effects help reduce pregnancy complications like preeclampsia. For women with fertility challenges, especially those with conditions like endometriosis, the function of the corpus luteum can sometimes be compromised. This can lead to luteal phase defects, where not enough progesterone is produced, making it harder to conceive or keep a pregnancy. That's why progesterone supplements are often used in fertility treatments to support the corpus luteum and improve chances of success. In summary, the corpus luteum is like a tiny hormone factory that creates the perfect environment for an embryo to grow in the early weeks. Its ability to produce enough progesterone and other hormones is vital for implantation and early pregnancy maintenance. When it doesn't work properly, it can make pregnancy more difficult. That's why understanding its role helps us better support reproductive health and address fertility issues. Always remember to consult healthcare professionals for personalized advice and treatment options.